Hello, everyone. I'm Ned Calonge. I'm the President and CEO of the Colorado Trust, and I'm the committee chair for this National Academies of Science, Engineering, and Medicine study on guidance on PFAS testing and health outcomes. This study is undertaken jointly by the Board on Environmental Studies and Toxicology and the Board on Population Health and Public Health Practice, both at the National Academies. This is our fourth meeting. Today, we hope to hear presentations, discussions, and public comments by Western U.S. community members who are impacted by PFAS. We also wish to learn how the National Academies Consensus Study guidance on PFAS testing and health outcomes would be useful to impacted communities. And we want to provide a forum for our committee members to ask questions about community impacts and speakers' experiences. I have a disclaimer for public sessions that I'm going to read. As chair of the Committee on Guidance on PFAS Testing and Health Outcomes, I would like to welcome everyone to our fourth town hall, our third town hall, committee's fourth meeting. This is an open, on-the-record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. For those of you not familiar with the committee process, this is the fourth of several planned public committee meetings. In the public sessions, we'll have the opportunity to hear from many experts in the field and to receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee. And then the committee must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it is considered an NRC report. The expected report release is spring of 2022. Further information on the study, including future meetings, can be found on the project website, which you can easily find by typing NASEM guidance on PFAS into your browser. The committee is being asked to provide advice for clinicians about PFAS testing and how test results should inform clinical care. Additionally, our expert committee will examine the health outcomes associated with PFAS exposure and will develop principles clinicians can use to advise patients on exposure reduction. The town hall today provides an opportunity for the committee to hear from Western U.S. community members impacted by PFAS. We also want to take this opportunity to learn more about how the National Academy's Consensus Study guidance on PFAS testing and health outcomes would be useful to impacted communities. During the panel discussions, the moderator and committee will ask questions of the speakers. If you're viewing on the web, you may send any comments to Liz Boyle at EBOYLE, that's eBoyle, at nas.edu. The meeting is being recorded. Available speaker presentations will be posted to the project website soon after the meeting. I'm now going to ask the committee to briefly introduce themselves with their name and affiliation only in the interest of time. And again, I'm Ned Calonge. I'm Associate Professor of Family Medicine and of Epidemiology at the Colorado School of Public Health and School of Medicine. And Erin, could you introduce yourself?
Hello, my name is Erin Bell. I'm a professor in environmental health sciences at the University of Albany School of Public Health.
Next, I would have Dana. Who I don't see right now. Kevin.
Hi, I'm Kevin Elliott. I'm a professor at Michigan State University and a member of MSU's Center for PFAS Research.
Thanks, Kevin. Melissa?
I did not unmute myself. Hi, I'm Melissa Gonzalez. I'm a professor at the University of New Mexico School of Medicine.
Thanks. Erin Haynes.
Good afternoon. I'm Erin Haynes. I am Chair and Professor of Epidemiology and Preventive Medicine and Environmental Health at the University of Kentucky, also Deputy Director of our Environmental Health Center.
Tamara.
Hi, everyone. I'm Tamara James Todd. I'm an assistant professor at Harvard Chan School of Public Health and Departments of Environmental Health and Epidemiology.
Alex.
Hi, I'm Alex Kemper. I'm Chief of Primary Care Pediatrics at Nationwide Children's Hospital in Columbus, Ohio.
Thanks, Alex. Brian.
Yes, hi, my name is Brian Lind. I'm an occupational medicine physician at the School of Medicine in Connecticut.
Hey, Brian, can you try it one more time with your video off because we didn't catch that all? Okay, so I'll go on to Mark.
Hi, I'm Mark Werner. I'm a professor at the University of Montreal School of Public Health.
Veronica.
I'm Veronica Vieira. I am a professor and interim chair at the University of California, Irvine in the Department of Environmental and Occupational Health.
Chad in.
Hello, everyone. I'm Xiaobing Wang. I'm a professor at the Johns Hopkins Bloomberg School of Public Health and the School of Medicine. I'm also a pediatrician and director of the Center on Early Life Origins of Disease.
Chris Wyatt.
Morning. My name is Chris Wyatt. I'm the recently retired president and CEO of the Caring for Colorado Foundation, and prior to that, the executive director of the Tri-County Health Department in Colorado.
Now, if we could quickly turn to staff to introduce themselves, starting with Elizabeth.
Hi, I'm Elizabeth Boyle. I'm a senior program officer here at the National Academies, and I'm the director of this study.
Rose.
Rose Martinez. I direct the Board on Population Health and Public Health Practice at the Academies.
Marilee.
Hi, I'm Marilee Shelton Davenport. I'm a senior program officer in the Board on Environmental Studies and Toxicology.
Kate.
Hello, everyone. I'm Kate Guyton. I just joined the National Academies as a senior program officer on the Board of Environmental Studies and Toxicology. It's really nice to see some people again and to meet some new faces. So thank you very much.
Kaylee.
Hi, everyone. My name is Kaylee Vines. I'm an associate program officer with the Board on Environmental Studies and Toxicology.
And Alexandra.
Hello, everyone. I'm Alexandra McKay, and I'm a senior program assistant on the Board on Population Health and Public Health Practice.
Thank you all. Thanks all for participating and joining us today. There may be a couple of other, or at least one more or two more committee members who join a little bit later. And for now, I think we'll go ahead and get started. The structure of the agenda today is we're going to divide up into panels that roughly follow the public health regions across the western part of the United States. So we'll have 10-minute talks by each speaker, and then there'll be a panel discussion that'll be moderated by our moderator. Committee members, I encourage you to ask questions using the raise hand function during the panel discussion. Once we've worked through a number of regional comments, we will close with an open public comment period.